I'm Dr. Gabriel Costa, and in over 17 years as a physician, I've cared for thousands of patients and seen, believe me, just about everything. I've celebrated recoveries that seemed impossible and stood beside families in their darkest moments. And all of that experience, all those years on the front lines of health, have taught me something that almost never gets said out loud. Sometimes the wisest medicine is knowing when, quite simply, nothing needs to be done. Today, I want to share something very personal with you, something that goes against the grain of what most people think, and that I suspect will genuinely surprise you. I'm going to reveal the 5 routine medical screenings that I, personally, after the age of 70, would never have done on myself, and I don't say that out of carelessness or caprice. I say it with the full weight of decades of evidence of watching the consequences of a medicine that sometimes, in its obsession with finding everything, ends up doing more harm than good. These tests, marketed to us as the very latest in prevention, can pull us into a spiral of anxiety, invasive procedures, and complications that rob us of exactly what we value most in our golden years: independence and quality of life. So if you are over 70, or if your parents or grandparents are around that age, stay with me. I won't just tell you which tests to avoid, I'll explain why, with real patient stories and with scientific evidence that leaves no room for doubt. And most importantly, I'll give you the alternatives, the smarter, safer, and often simpler strategies for genuinely protecting your health, for living longer, and above all, for living better. This is not about fearing doctors. This is about becoming an informed patient who takes the wheel. Let's get started. The first screening on my list is perhaps the most tempting of all: the full body scan. You've seen it advertised at executive health clinics, promising a head-to-toe review with the latest MRI or CT technology. It sounds incredible, doesn't it? A complete picture of your insides to catch anything before it surfaces. It's the promise of total control. But the reality, I have to tell you, is very different and frequently dangerous. Let me tell you about Robert, a patient of mine, 74 years old, a man full of life. He played golf, traveled with his wife, enjoyed his grandchildren. He was healthy, not a single symptom. One day, his son, with the best intentions in the world, gave him an executive health check as a birthday gift, one that included one of these full-body scans. Robert went along more to make his son happy than for any other reason. And right there, right at that moment, his troubles began. The scan report came back with a note that stopped him cold. A small, indeterminate lesion of 1.5 centimeters has been identified in the left kidney. Indeterminate lesion. 2 words that are an anxiety bomb. Overnight, Robert went from being a healthy man to being a patient with a kidney lesion. His doctor, following standard protocol, referred him to a urologist. The urologist, wanting to be sure, recommended a biopsy. A kidney biopsy is not a minor thing. It involves inserting a long needle through the back into the kidney. There are real risks: bleeding, infection, pain. Robert bravely agreed. The results took a week that he and his family spent in a state of panic. And the final verdict: angiomyolipoma, a completely benign tumor, entirely harmless, made of fat, muscle, and blood vessels that would never have caused him the slightest problem. Robert gained nothing. On the contrary, he lost. He lost his peace of mind. He underwent an invasive and risky procedure, and he caused tremendous anguish to his family. His case is not the exception. Sadly, it is what typically happens. And here is the piece of scientific data that changes everything. Studies show that in up to 86% of healthy older adults who undergo a full-body scan, something is found. 86%. The vast majority of those somethings, just like Robert's, are what we call incidentalomas. Incidental findings: benign, inconsequential, spots on the liver, cysts in the kidneys, nodules in the lungs, scars of time that have been there for years and will never become a problem. The real issue is that once you find something, what we call the intervention cascade is triggered. The finding creates anxiety. The anxiety leads to more tests. The tests can be invasive and carry their own risks, and it can all end in treatments or surgeries that were entirely unnecessary. This snowball starts rolling with a test that should never have been done in the first place. On top of that, if the scan is a CT scan, we're talking about a meaningful dose of radiation that can be equivalent to hundreds of chest X-rays. Radiation accumulates, and while the risk from a single scan is low, it is not zero. Why take on that risk with no clear benefit? So what is the intelligent alternative? The answer lies not in a machine, but in something far more human: the comprehensive geriatric assessment. This is not a simple checkup. It's a thorough conversation with a doctor who understands how we age. Instead of hunting for ghosts, we focus on what truly matters for quality of life: function. In this kind of evaluation, the first thing we do is a frailty assessment. That's not an insult, it's a vital medical concept. We measure simple things like walking speed and grip strength. These markers predict future health far better than any imaging study. If we detect early signs of frailty, we can act with exercise and nutrition to reverse it. Then, and this is key, we do a thorough medication review. It is remarkably common to see older adults taking 10 or more prescription medications, each prescribed by a different specialist. Very often, symptoms like dizziness or confusion are not a new disease. They are the side effect of one of those pills. Streamlining that list can work wonders. And finally, we assess lifestyle habits: diet, sleep, physical activity, and social connection. These are the true pillars of prevention. And as your doctor, I want you to hear this clearly, because this is where wellness is really built. An anti-inflammatory diet and regular exercise prevent more disease than any scan ever could. This kind of assessment doesn't create anxiety, it gives you power. It doesn't hunt for theoretical problems, it optimizes your real health. So the next time you see an advertisement promising a complete map of your health, think of Robert and choose the wisdom of a person-centered evaluation over an image-centered one. The second screening I avoid like the plague is the routine brain MRI for mild forgetfulness. This one comes up constantly in my practice. A patient in their mid-70s or 80s comes in, often brought by their children, because they occasionally forget an actor's name or can't remember why they walked upstairs. Classic age-related absent-mindedness. They are not getting lost, they are not disoriented, they manage their finances perfectly, but the fear of Alzheimer's is so powerful that the family insists on an MRI to see what's going on in there. I want you to understand this clearly. Ordering an MRI in this situation is almost always a very bad idea. It's opening a Pandora's box from which only anxiety emerges. Take Margaret, 78 years old, a brilliant woman, an avid reader, who began to notice that she occasionally struggled to find exactly the right word. Her daughter, deeply worried, convinced her to have an MRI. The day they read the report, Margaret's world fell apart. The radiologist described mild diffuse cortical atrophy appropriate for age and scattered white matter foci of gliosis. For a physician, that report is essentially a description of a normal 78-year-old brain. It's like saying that someone of that age has wrinkles or gray hair. The atrophy is a slight normal reduction in brain volume that occurs with time. The white matter lesions are like small scars that form gradually, often from blood pressure that has been slightly elevated over decades. They are expected findings, but for Margaret and her daughter, it sounded like a death sentence. Brain atrophy, lesions. They left the office convinced that Alzheimer's was imminent. From that day on, Margaret changed. She began to doubt herself. She gave up her book club out of fear of not remembering a name. The MRI gave her no diagnosis. It stole her confidence in her own mind. And here comes the striking part. In studies involving healthy adults, over 94% of brain MRIs show abnormal findings. Nearly all of them. If we scan 100 healthy people of that age, 94 will come back with a report that could sow panic. The problem is that those images don't correlate well with a person's actual cognitive function. I've seen patients with MRIs that looked like a battlefield and a razor-sharp mind, and the reverse as well. The image is not the person, and what's worse, the MRI result does not change the management of mild forgetfulness at all. There is no pill that reverses age-related atrophy. So what is the sensible alternative? The most valuable tool is a simple 10-minute cognitive test done right in the office, such as the Mini Mental State Examination or the MoCA. We ask the patient to remember 3 words and draw a clock. It is simple, fast, and gives us enormously valuable functional information. If the test is normal, we can reassure the family with a high degree of confidence. If it shows some difficulty, then we don't stop there. We begin what I call the search for the hidden culprits, the reversible causes of memory problems. Before we even think about Alzheimer's, we rule out a list of common and above all treatable causes. Medication review, again, the prime suspect. Sleep aids, anti-anxiety medications, certain antihistamines can all cause mental fog. Blood work, we check vitamin B12 levels and thyroid function. A deficiency or an underactive thyroid are classic, easily correctable causes. Mood assessment, depression in older adults often presents as apathy and memory lapses. Treating it can restore mental clarity. Sleep quality, sleep apnea, which cuts off oxygen to the brain at night, is a greatly underestimated cause of cognitive problems. Only after ruling all of this out, if functional tests show a progressive decline, would imaging make sense as part of a comprehensive investigation. The message is clear. When someone is experiencing mild forgetfulness, don't rush to the MRI machine. Reach for a doctor who will sit down and talk with you, evaluate your real-world function, and look for reversible causes. The third screening on my list is the routine cardiac stress test. I mean putting someone over 70 who feels perfectly well, with no chest pain and no shortness of breath, on a treadmill simply because they've reached a certain age. This practice, though very common, is fraught with problems and can be genuinely dangerous. The story of James makes this absolutely clear. 72 years old, active, played tennis and walked every day. 0 cardiac symptoms. He was scheduled for hernia surgery, and the hospital's protocol required a stress test for all patients over 70. James didn't understand it. If he could play a 2-hour tennis match, why did he need to run on a treadmill? But protocol is protocol. During the test, James began to feel pressure in his chest. The electrocardiogram showed equivocal changes. The cardiologist stopped the test and, faced with a borderline positive result, recommended the next step, a cardiac catheterization. A catheterization is invasive. A tube is passed through an artery all the way to the heart to visualize the coronary arteries. James, who had walked in for a simple test, was now being wheeled into a cardiac procedure. The result, his arteries had some cholesterol buildup, normal for his age, blockages of 30 to 40% that required neither a stent nor any intervention. What happened? James had a false positive. The treadmill stress test has a very high false positive rate in older adults. It can produce an abnormal result for 1,000 reasons that have nothing to do with a dangerous blockage, but the damage was done. James was labeled as a cardiac patient. He was prescribed a handful of medications, and worst of all, he became afraid of physical exertion. He gave up tennis. The test meant to protect him had stolen his quality of life, and that's without even counting that the test itself can, in rare cases, trigger an arrhythmia or a heart attack. So what is the logical alternative? First and fundamentally, listening to our bodies. The best stress test is daily life. If you can climb 2 flights of stairs or walk briskly without chest pain, you are already passing your stress test every single day. It is essential to learn to recognize real warning signs: chest pain with exertion, disproportionate shortness of breath, dizziness. If any of these appear, see a doctor. That is precisely when a test is indicated. Now, if we want to assess future risk, there is a far more modern and safer tool, the coronary artery calcium score. It is a simple, low-radiation CT scan, no needles, that takes 5 minutes. It measures the amount of calcium, hardened cholesterol in the walls of the arteries. The result is a single number. A score of 0 means a very low risk of heart attack over the coming years. A high score tells us it's time to get serious about prevention. The calcium score tells us what our risk level is, not whether an artery is blocked. It is a tool to guide prevention, not to trigger invasive procedures. My advice: don't let anyone put you on a treadmill just in case. Trust your body, and if you want to sharpen your risk assessment, ask about the coronary artery calcium score. Now we reach the 4th screening, and this one is probably the most controversial, because the colonoscopy is a fantastic tool, but its usefulness depends entirely on age. The specific screening I advise against is the routine colonoscopy after the ages of 75 to 80 for someone whose previous screenings have been normal and who has no special risk factors. To be clear, I am not against colonoscopy. I recommend it without hesitation starting at age 45 or 50. It prevents colon cancer by allowing us to remove polyps before they become malignant. The problem arises when we apply that same logic to people of advanced age. In medicine, we must always weigh benefit against risk, and in an 80-year-old, the scales tip toward risk. Let me tell you about Eleanor, 79 years old. Her last colonoscopy at age 70 was normal. Her doctor's computer system flagged that she was due for another. Eleanor had no symptoms, but she was a diligent patient. The preparation for the procedure was an ordeal. Liters of laxative solution that had her in the bathroom all night, leaving her weak and dehydrated. For someone her age, that alone is a risk. Then there is the sedation, which in older adults carries a higher risk of confusion or respiratory complications. But the risk that keeps physicians up at night is intestinal perforation. With age, the wall of the colon becomes thinner. The risk of a tear from the endoscope, though low, 1 or 2 per 1,000, doubles or triples in patients over 75. And a perforation is a surgical emergency that often requires major surgery, sometimes resulting in a colostomy. For an 80-year-old, an operation like that can mean the end of their independence. Now, what is the benefit? Preventing a cancer that, if it appeared, would take 5 to 10 years to cause problems. Major medical guidelines, including those from the United States Preventive Services Task Force, already recommend discontinuing routine colon cancer screening between the ages of 75 and 85. The logic is straightforward. A colonoscopy is more likely to cause harm than to prevent a future cancer if your life expectancy is under 10 years. Of course, this doesn't apply to everyone. Family history, prior polyps, and similar factors change the equation entirely. But for the average person, continuing to have them routinely is an unnecessary risk. So what do? Do we forget about the colon entirely? Absolutely not. We shift from invasive screening to intelligent surveillance. First, symptom monitoring. This is vital. Seek medical attention promptly if you notice a persistent change in bowel habits, blood in the stool, abdominal pain, unexplained weight loss, or new anemia. In those cases, age is irrelevant and a colonoscopy is fully justified. Second, and most powerful, active prevention through diet. The key to a healthy colon is fiber, fruits, vegetables, legumes, and whole grains. Fiber feeds our beneficial gut bacteria, which produce anti-inflammatory and anti-cancer compounds. Eating more lentils, broccoli, oats, or apples is an intervention that is far safer and benefits the entire body. My message: have your colonoscopies at the right time and at the right age. Up to 75, it is genuinely important. After that, for most people, it is time to focus on watching for symptoms and on the power of what we put on our plates. And we arrive at the fifth and final screening. This one is for men, and it is one of the most debated topics in medicine: the blood test for prostate-specific antigen, or PSA, for prostate cancer detection, particularly in men over 75. The PSA was sold as the great promise for catching prostate cancer early. The problem is that the biology of this cancer, especially in older men, is highly unpredictable, and the indiscriminate use of PSA has created an epidemic of overdiagnosis and overtreatment. Let me explain with the story of Charles, 80 years old, a widower, independent, and active. During his annual checkup, a routine PSA was ordered. It came back at 6.5, slightly elevated. Charles felt perfectly well, but that number was the starting gun for the cascade. From his family doctor to a urologist, and from the urologist to a prostate biopsy. A prostate biopsy is unpleasant and carries real risks, particularly of serious infection and sepsis. Charles was unlucky. He ended up hospitalized with sepsis. He recovered, but then the biopsy result arrived: prostate adenocarcinoma, Gleason 6. A cancer had been found. But what kind of cancer? A Gleason 6 is the most indolent form of prostate cancer that exists. It is so slow growing that many of us question whether it should even be called cancer. The probability that an 80-year-old man will die from a Gleason 6 is nearly zero. He will almost certainly die with it, not from it. In fact, autopsy studies show that up to 80% of men in their 80s harbor microscopic foci of prostate cancer without it affecting them in the slightest. But Charles was told he had cancer, and when people hear that word, they want it gone. Despite being offered active surveillance, monitoring without treating, the anxiety got the better of him, and he chose radiation therapy. The treatment was technically successful, but the price was enormous. The radiation caused permanent urinary incontinence and erectile dysfunction. His social life collapsed. We cured a cancer that would never have killed him, but in the process, we destroyed his quality of life. This is the perfect example of overdiagnosis: finding a cancer that would never have caused harm, and overtreatment, aggressive therapy for a harmless disease. And PSA is the engine driving all of it. The PSA can rise for 1,000 reasons: inflammation, infection, even cycling. For every man who is genuinely saved by a PSA test, it is estimated that around 50 others are diagnosed and treated unnecessarily, suffering permanent consequences. So what do? Do we throw PSA out entirely? No. We do something far more intelligent. We replace the automatic screening with a shared, informed decision. The doctor must have an honest conversation with the patient, explaining the pros and cons in clear terms. And then the patient decides what matters most to him: the remote possibility of gaining a little more time against the very real risk of compromising his quality of life. For those diagnosed with a low-risk cancer, the alternative to treatment is active surveillance. It is not doing nothing. It is a rigorous follow-up program to ensure that the tumor does not become aggressive. And of course, we focus on real symptoms: difficulty urinating, blood, bone pain. Those absolutely require investigation at any age, and there you have them. The 5 screenings that, based on my experience and the evidence in senior health and wellness, I would never have done after the age of 70. The full body scan, a factory of anxiety; the brain MRI for mild forgetfulness, which labels you as abnormal without good reason; the routine stress test, which carries more risk than benefit; the colonoscopy after 75, where the scales tip toward danger; and the routine PSA in older men, the champion of overdiagnosis. Do you see the thread running through all of this? It is a call for a wiser medicine, more personalized, more human. A medicine that understands that, especially in later life, the goal is not only to live longer, but to live better, with quality, independence, and joy. True prevention is not a battery of tests hunting for ghosts. It is a partnership with your doctor, an evaluation centered on your function, and a daily commitment to a healthy lifestyle. And I always encourage you to have those conversations with your own physician before making any changes to your care. My goal is not for you to be afraid of medicine. On the contrary, it is for you to become the protagonist of your own health, to ask questions, to understand the reason behind every test, to feel comfortable saying, "Doctor, do I really need this at my age, given my situation?" Health is not a report free of anomalies. Health is being able to play with your grandchildren, enjoy a walk, keep the mind sharp and the spirit alive. And sometimes the bravest and healthiest decision we can make is to say no to an unnecessary screening. If this message has been useful to you, if it might help someone you love, I'd ask you to share this video. And to keep receiving more tips grounded in real experience for a long and fulfilling life, subscribe to this channel and hit the notification bell. I'd love to hear what you think. Leave me a comment. Have you ever felt pressured into a screening that didn't sit right with you? I'll read as many as I can. Thank you for being here. Take care of yourselves, and above all, take care of yourselves with wisdom.